Welcome to the latest installment of the Brian A. Joyce Report, and we try to bring to you some of the most important newsmakers in our district and the towns I represent in Norfolk, Bristol, and Plymouth counties, and also the most important folks shaping public policy on Beacon Hill at the State House. And today I'm honored to have as our guest one of the most important persons who's shaping public policy, the Senate President, Therese Murray. Welcome.
Thank you.
So here's the thing. The Massachusetts State Senate dates back in its current iteration to 1780. During that period, we have had some 89 Senate presidents. 88 of those Senate presidents were men. Therese Murray is the first woman to hold this important seat, which was held by, among others, Calvin Coolidge. I don't know if John
Sam
had
Adams.
Sam Adams. I've had his beer.
Pinkerton.
Pinkerton.
Otis.
Otis.
A lot of the founding fathers were Senate presidents, and of course Otis today, Otis Elevator. A lot of names that you are very familiar with the public were Senate presidents.
But we've never had any founding mothers. We had founding fathers. So
that's right.
How'd that come about?
Well, it's about time, I think.
Yeah.
And it's obviously a privilege to serve, and to be the first woman is just an added to the feeling that one gets when they reach that position.
How did Therese Murray get involved in politics? Tell me about you.
I have no idea. I certainly never aspired to be a politician or to run for office. I supported, since I was a little kid, growing up in Mission Hill and Dorchester, we used to pass out the flyers for the various candidates would come by and say,
like
hey,
who? Who were some of the candidates?
Paul Murphy over in Dorchester. My uncle worked for JFK and then Ted Kennedy over in Alston, and he'd give us flyers to pass out in our precincts, and we used to love collecting the old sepia ones, almost like baseball trading cards. Had no idea who these people were most of the time, but that was fun. But that was the extent of my political ambition. And then worked on lots of other people's campaigns, Dukakis and Evelyn Murphy and John Kerry. I think John was really the first person I got involved in, and then Evelyn, and then Michael, and kind of caught the bug as supporting people and ran for a state committee. Again, never thinking I would run for office, and but always supported the people who did. And many people came and asked me over and over, "Please run, please run." And at the time, I said I couldn't afford it. The pay was very low, and I was making a lot more money. And then it happened that there was an opportunity, since I was laid off by the Republican administration, even though my position wasn't political, that I ran, and I won. And I think it was a big surprise to me and everybody else, but I beat a 20-year incumbent, Republican incumbent, and here I am.
You know, it's funny, we all have our own stories, and I can remember standing outside the Kidder Branch Library in Milton handing out palm cards on behalf of my brothers running for Milton Town Meeting member, and my wife Mary describes it as essentially a genetic defect. There's this gene that's passed down in certain families, maybe you got it from your uncle, this love of politics, and I reminded the governor, the very first political campaigning I think he did was that leafleting you refer to. I had a crew of guys that would come to my house at about 6 o'clock in the morning when I was running for the vaunted position of Milton Park Commissioner. And he was on that crew, and we were out leafleting, and here I am all these years later still leafleting some of those same doors. But that's, that retail politics, I think, for a lot of us is a lot more fun. Now you're playing on a bigger stage, and it's no longer retail. It's often your in mass media, you're on the news, you're the butt of jokes at the St. Patrick's Day breakfast, and so people that have never met you form opinions of you, and it's a little bit different, isn't it?
It is different, and you have to. I think one of the biggest and most important rules in politics is to define yourself before someone else defines you, and somehow we forget that in the rush of what we're doing and the work we do. But people have all kinds of ideas about how wealthy we are, which is pretty crazy. You know, I grew up in Mission Hill and Dorchester. Both my parents worked. Come from a very large family. And if it weren't for my sisters helping out my first campaign, all of them, stuffing envelopes and folding them and, you know, putting stickers out and just doing everything. And my cousins.
What did your parents do?
My mother was a bookkeeper at Kearney Hospital. Is that your district?
It used to be.
Used to be.
Used to be, yeah.
Yeah, and my dad worked for a Campbell and Hall book company until they went down. Then he worked, and he worked 2 jobs. He worked for South End Harbor, Campbell and Hall book company at the same time, and he worked at a caterer's on the day off, the one day off. So he was a very hard worker.
So early in your career in the Senate, you had a reputation as somewhat of a champion. You still do, but somewhat of a champion of perhaps the voiceless. You know, the folks that are maybe single parents that are struggling to make ends meet, or folks that may be disabled, or somehow not the powerful vested groups that you often think of controlling Beacon Hill. Is that born from your own experience, or how did you get involved in, I guess, advocating for some of the, I guess, less fortunate among us?
Well, when I came to the Senate, I was named Chair of Human Services and Elderly Affairs and had absolutely no background in that. And like I said, I came from a 2-parent family. Everybody worked. We all got our working papers at 14. And we kind of supported our own, the things we wanted to do with that money. And we turned most of it over to my mother. And she let us have whatever she thought was right for the week. So I was born with a good work ethic and grew up with a good work ethic and good role models. So when I became Chair of Human Services and saw just the enormous amount of need out there, but I also saw that there was some waste in the system, and that's why I headed up welfare reform and reorganization of the Department of Social Services into Children's and Family Services, and try to take a look at how to protect those young women who were having children from the guys in their lives who would frequently harm them and their children. So when we did welfare reform, we set up the teen parenting program, that if your family won't keep you and you're pregnant, that you can live in a bridge home with your child afterwards. You have to take parenting classes, you have to stay in school, but you don't get that check. You don't get the support unless you help support yourself and your child by finishing your education, or you know, and making sure that you know how to take care of a child. Before that, the federal government would actually tell us that no matter the age of the child, 16, 17, here's your check, see you later, never check back on them. So they were having 2 and 3 and 4 children from all different men, and they and these children were being abused. So we put a stop to that, and we came from second highest in the country for teen births to almost the lowest once we put through welfare reform.
So, as a student of history, I love to read about, you know, from some of the folks that came before us. And Tip O'Neill, the former great Speaker of the House here, of the Massachusetts House and of the U.S. House, said that you can get an awful lot done in politics if you're not concerned about getting credit. And I remember that welfare reform, I think it was 1996 that you spoke about, and it really was historic, and it positively shaped our Commonwealth and thousands of people's lives and saved a lot of money. And it seems to me that former Governor Weld liked to take a lot of credit, and yet those of us in the building thought you carried the laboring oar and deserved much of the credit, but it's never seemed to be a big thing with you about whether it's healthcare reform or whatever your issue. It's not, you're not big on, I guess, beating your chest and proclaiming, you know, your victories.
Well, as you know, one person doesn't carry everything. You need to, in the Senate, I had to convince, you know, 21 other members in order to get something passed, that this was the right thing to do, and we had some extremely liberal, caring members who thought it was the wrong thing to do. And when it went down, my first term, when I had brought it up, they were disappointed. They came back with a more liberal bill. I came back with a more conservative bill, and we eventually came together. And it was under the governor's watch. It was under Bill Well's watch that it happened. So, of course, he'd take credit for it. And I don't have a problem with any of that, as long as it happens, as long as the policy is changed for the good. And that benefited everybody in that system. We changed that system, and it benefited the Commonwealth because we weren't throwing money at a problem, making it worse.
So we have a fair amount of problems before us today. We have several years of a very, very difficult economy, perhaps the worst since the Depression. We're coming out of it now, but it's a slow climb. We've had some extraordinary challenges under your watch. What do you, I guess, view as your greatest challenge and our collective greatest accomplishments during those periods?
Well, I think our greatest challenge today continues to be the budget and the shortfall in the budget given the recession that began in 2008. But in 2008, we were extremely healthy and had a very robust rainy day fund, thank God. And we had put that aside. Now, if you remember, the minority leader in the Senate and others were pushing us, including Governor Romney, saying it's ridiculous to keep that money sitting there. You should be investing or spending that money. Well, if we had, where would we have been the last 2 years or 3 years? So I'm glad we didn't touch the money that we.
I give a lot of credit, and again, it's a lot of people involved. I give a lot of credit for that to former Speaker Finneran in that he was among those who was quite insistent in socking a lot of money away into the so-called rainy day fund. And boy, when it started raining, it was pouring. And I think we were better prepared than any other state in the union proportionally with the amount of money we'd set aside.
We absolutely were. And that's why we're doing better today than most every other state. There's a couple who have natural resources like Texas that we can't compete with in that area. But yeah, we're doing much better.
And you were the chair of Ways and Means during some of this period prior to becoming Senate President. So there was pressure on you as well to spend some of this money.
Absolutely. And I agreed with our former Senate President Travellini that money had to be put in a safe place. And when things were going, you remember, we were skyrocketing 2006 and 2007. The money was coming in. People were working. We had very low unemployment. And who could possibly foresee anything bad happening? Well, we still held on to the money. And, of course, it did happen. We had to lower our benchmarks in our budgets, and we had to cut our budgets 3 times within 6 months as just the bottom fell out of the housing market.
So that's the other thing that it's important to note. While we had money socked away for the rainy day fund, we also made some very quick, decisive, and deep cuts. Talk a little bit about that.
We've lost a lot of state jobs. The cities and towns have lost a lot of municipal jobs because as we went in and had a cut during the budget, we are not like the federal government. We have to have a balanced budget under our Constitution. So if you are basing your budget on X amount of dollars and those dollars aren't coming in, you have to cut. We can't continue to spend, so we cut. And then we came back and we cut again, and we came back and we cut again, and then of course the 2 budgets since then have been significantly lower.
And we're estimating this year to spend less money or for next year to spend less money than the existing year. Fiscal 12 could be lower than fiscal 11.
It will be because of the increasing costs in our interest and our debt, and you know about that as the chair of your committee. We still have to pay the interest payments on our debt, and we still have to pay our debts. So that doesn't go down, and that doesn't change. We have to pay it. So everything else has to go down.
So for the people listening at home, it is important to draw a distinction between the federal and the state government, where the federal government can essentially print money and put put our children and their children and their children into debt, and it increases inflationary pressures, devalues the dollar. Here on the state level, into our Constitution is a requirement that the budget must be balanced each year, and I think that's a very important part of our Constitution. In fact, natural tendency for all of us is to want to increase spending for a whole host of worthwhile programs. But thankfully, we can't. Thankfully, we have to have this balanced budget. One of the things the Senate President has mentioned is her concern with respect to our long-term debt, our borrowing, and how that has increased. And again, you just see the natural tendency from every administration to want to put people to work to improve the infrastructure, everything from improving roads and bridges to perhaps building a rail line to Fall River, New Bedford. And yet these expenditures, which can be in the billions of dollars, come at a great cost, borrowing and putting debt off to future generations. One of the things the Senate President has talked about is trying to rein in our long-term spending and our debt, which is, I think, among the highest in the nation right now.
It is, and it has to be addressed. And I think we're moving towards that. We are very lucky in that we have a great bond rating. And we got the great bond rating because we managed our money through the recession, and we had a healthy rainy day fund, and we didn't continue to spend, and we didn't securitize our tobacco funds. There are a number of things states did, including privatizing their lotteries, that gave them short-term fixes, but long-term problems.
Some states, like California, I think, rather than addressing and making the decisive cuts that we've made here under your leadership, actually borrowed against future dollars, as you suggest, securitizing. I think of it like paying your mortgage with your credit card. Eventually, it's going to come home to roost.
It's going to catch up,
Yeah.
right.
And you also did something else. You appointed a particularly sharp individual to chair that committee. So
Yourself, yes,
Yeah.
I did.
I don't have that whole modesty thing that she has, not an issue with me. So what are the challenges facing us now?
Well, the budget is imminent. Has to be done. We'll have ours done in May. The House will have theirs done in April, and there's a $1.8 billion gap in maintenance funding between last year and this year. So
$1.8 billion. If we were going to have the same level of services, we're already almost $2 billion in the hole.
That's correct.
So how do we make that up?
Well, we're going to have to cut. We're going to have to be creative too. Now, last year and the year before, we were extremely creative in that we're taking all the transportation agencies and putting them together under one person and one umbrella. That is making a vast difference already. Particularly, just to give you an example, plowing roads in the winter. We had like 4 or 5 different entities that did that. Now they're all under one person. We figure out that there were some people that are actually defrauding, which is, I know, hard to believe. But we now have a system in place. Everybody knows where the trucks are, how much sand, how much salt, how many road miles they're hitting, and we save a lot, even though we have a horrific winter, and we're going to still be paying for it for a while. It's under control.
So necessity is the mother of invention. So we didn't have enough money, and we made some, shockingly, sometimes government is inefficient and wasteful, but the truth is, in the last couple of years, we've, as you suggest, combined, say, 7 transportation agencies into one. There is no longer a turnpike authority. There is no longer 7 different bureaucracies and administrations streamlined into one. Tell me, is it easier to work with you're a Democrat, you lead the Senate. We have a Democratic leader of the House, and we have a Democratic governor. Does that make things easier or more difficult to get
Sometimes it's more, it's always challenging. It doesn't make a difference whether the governor is Republican or the legislative leaders are Democratic. It's always a challenge because each governor, no matter what party they are in, brings their own policy and their own wants and decisions and what they would like to see done. And it's very frustrating for governors who come from the private sector in particular, and those are the only ones I've ever dealt with, because they get to government and they say, well, why can't this move faster? I want this done. Do this, and they want it done tomorrow. We have statutes and laws and regulations that we have to abide by, and I know that's very frustrating. And it took from Romney to Patrick to actually do the reorganization of all the. We started under Romney of all the transportation agencies. We did it in 2 shots over 4 years. Last year we did the economic development agencies. I had spent a year. Karen Spilker and I, the senator from Framingham, spent a year looking at all the different agencies that have to do with economic development. There were 40. Some of them we never heard of. Some of them have money and spent money that no one had any control over. So now we have now pulled them all together, and we actually have a marketing partnership for the Commonwealth that contains a number of those agencies. We have one-stop shopping. We have a place where if you want to come do business in Massachusetts, this is where you go. This is who follows you through. And if you're a business in Massachusetts wants to expand, we have somebody for you.
So we've done the reform of the transportation agencies, and I think they estimated that savings over the next 20 years in excess of $1 billion, I think.
That's right.
You've streamlined the economic development agencies in order to promote job growth. Some of the other things in the last couple of years, some pension reforms.
Pension reforms,
ethics.
healthcare reforms, ethics reforms, and just one thing we did with healthcare reform that will kick in January of 12 is uniform coding for insurance companies. It will save us $1 billion.
Imagine that.
And it took us 4 years to try and get it through because a lot of the parties didn't want it. They wanted to use, a lot of the insurance companies wanted to continue to use their own codes, but the cost of you as a doctor who might have 6 or 7 different insurance companies you're working with your clients, and you have to fill out different forms and you get the code wrong. Well, it's rejected. It comes back to you. It comes back to the patient saying you're not covered. The cost of just the paperwork and the time and who's holding on to your money when it should be in your practice is pretty enormous. So that's going to be an amazing feat.
So in the last couple of years, we've actually had a very productive session. Last couple of sessions, actually, we've done the transportation reform, pension reform. Public pension reform was a big deal. Passed perhaps the toughest ethics bill in the nation. You've done the economic development bill. Now, what appears to be the greatest challenge is trying to rein in the runaway healthcare costs that you refer to. Now, some of the savings, although you know, you've depicted it, I think, as trying to herd cats to try to get all these different players into a room and going in the same direction. Something as simple as uniform coding or electronic billing. I know I have an uncle who I take to his doctor's appointments, and you know, every single time it seems you're filling out the same paperwork in you know, at the same doctor's office repeatedly, and somebody's got to key that in. I mean, some efficiencies I think are fairly easy. Others are far more difficult. You have been a proponent, I think, of this so-called global payment structure where we would dramatically change how we pay for health care in Massachusetts, where we would no longer have the fee-for-service model, but...
Well, not for everybody.
Okay.
Not for everybody. Global payment will work in many instances for these accredited care organizations.
Explain a little bit what it is.
Accredited care organizations are when doctors and providers come together and decide to form a network where they will care for X amount of patients for X amount of dollars, and they can get a profit. So they could make a profit at the end of that if they keep them healthy and wealthy in their prevention programs. And a lot of the young doctors are very energized about this. But it means the primary care doctor, and this is doctor driven. It has to be. The primary care doctor is the key to the medical home model and the global payment system. There'll be outliers. There'll be specialists that won't fit into the, you know, it will be a square peg in a round hole. So there'll be episodic payments. There'll be bundling payments. So it's not all global. And I know it scares people, particularly doctors who've been in the system for a long time, because everything is moving to new technology. But as we move into new technology, better outcomes for patients, much better outcomes for patients. Just the electronic prescriptions. So it's not scribbled because the doctor's in a hurry and he or she writes down something. It's electronically put into the system. And as of this January, as part of that system, we passed a law that also we're able to check on people who are maybe doing too many prescriptions for OxyContins or Perc 30s or Percocets. So we're also following the addiction stream and trying to stop that. And it helps identify those practitioners who are doing that. So, it also will cut fraud out of the system. If you're bringing your uncle and you're filling out these forms, and he may get in the mail from Medicare that they paid for a wheelchair, and he'll say, well, I didn't have a wheelchair. Well, that wheelchair was delivered to somebody in Mississippi who got a hold of your uncle's Medicare number. The fraud in Medicare is amazing. And with the federal government's new crackdown in ours through the Attorney General's office, that should help also in Medicaid. But that's a big loss in health care. A huge loss in healthcare is Medicare fraud.
Waste, inefficiency, and fraud. But nevertheless, the care of providing these medical services has risen at such an exponential rate that it's now threatens to swallow virtually
everything.
Everything. I mean, more than half of all state spending. If you look at the spending that goes for public employees, but more that goes to mass health, Medicaid for our poor and working families, that I think combined with that which is spent, say, in school teachers through the Chapter 70 funding and such, that it's got to be about half of all state spending, or it's getting pretty darn close.
Yeah, it can exceed that, but it's also in the private sector, and that's the problem too, because we're not going to grow jobs unless we can bring these costs down. And employees want to be good employees and participate with their employees in healthcare plans, but it's getting so costly. They're jumping from plan to plan every year trying to get a better deal, and it shouldn't be that way. Now we just saw some some reasons why we think in some of our insurance companies that the cost could have been higher.
Wasn't that disgraceful?
It's
Absolutely disgraceful. The $11 million payout to the failed departing executive from Blue Cross Blue Shield, a nonprofit, absolutely disgraceful.
Well, I think that everyone's got the message. All the boards have got the message, and the plans have got the message that these kind of incomes are not sustainable and shouldn't be passed off into the ratepayers.
But that appears to be the greatest challenge facing you and facing the all of us here in the State House in trying to reform and change the way medical costs are paid for, and it's just change is hard.
Change is very hard.
And this change, where it has so many stakeholders. Quick story, we had the very capable head of the Group Insurance Commission in to meet us in the Senate President's office in a caucus, and we were discussing you know, some pretty good efforts on the state level to keep insurance costs down. The Group Insurance Commission, insurance for public employees, went up only 2.5%. But really, it seems to me the old way to look at things is to do things like increase co-payments, increase premiums, reduce coverage, get away from prescription name brands to generics, and that's all good, but it seems that we have an opportunity to take a more holistic approach and try to incent positive behavior, you know,
Exactly.
get people to eat healthier, to exercise, to not smoke, to, you know, some of the preventative stuff. And it was funny, the story I had, I was telling this to someone afterwards. I had been at a local gym, and someone was giving a demonstration of all things acupuncture, and I said, "Wow, this is crazy! I'd never been exposed to this before." It's a gentle lady in Milton who has I think she has a master's degree in biochemistry from Harvard, has a master's degree or has a doctorate degree, has a master's degree in from the University of Iowa. I mean, a very well educated person. She was introducing me to acupuncture, and I just threw it out there to just to kind of bait the head of the GIC a little bit, but why aren't we looking at just alternative forms of treating people? And she said, well, we can't do that. We have to stick to the traditional things like Nexium and Lipitor. And I'm thinking Nexium and Lipitor are drugs that have been around for, you know, 15 years and
have side effects, significant side effects.
And so, you know, it might not be the answer, it might not be acupuncture, but I said, what's more traditional? It's been around 3,000 years. But I do think we have, it showed me how difficult it's going to be to change people's attitudes or receptivity to new ideas. And I think we have an opportunity to get incent positive behavior, proper eating, proper exercise, no smoking, limited alcohol intake, that sort of stuff in through these groups that you are proposing, where the doctors and the patients working cooperatively with a pool of money can help decide how to spend that money prudently and not just more fee for prescription medicines and tests that may be unnecessary.
Well, would also be a reinsurer, most likely, in many of these ACOs, so the group that comes together, if they have a number of people with catastrophic illnesses, they don't lose. You know, there's a reinsurance pool out there. The key is 10% of the people in the system spend most of the money. And that's heart disease, diabetes, and obesity. So if we can get a handle on the prevention and keeping that 10% healthy and not having them show up in our emergency rooms all the time because they're not taking their insulin or they're not testing themselves, we now have telehealth where you can get called every morning, Mr. Joyce, and say, how's your blood pressure? That you put a little cuff on, or you stand on a Wii board if you've had a heart attack and someone's following you afterwards. They can get your vitals and everything. And they say, okay, nope, you're okay. Today, someone checks on you every day. The cost of that is far less than having that person present themselves because they have not been doing or taking the medicine they should be taking.
When I went up to see my friend Dr. John Cronin at Milton Hospital, through the years, there's a little bit more of me to love, and he had indicated if I didn't get my blood pressure down, or I'm sorry, my cholesterol, I was going to have to take Lipitor. My wife is big on nutrition. Helped me change my diet. I got back into the gym every day, and I took fish oil pills every day. The next appointment, my cholesterol was perfect. my good cholesterol had risen and bad cholesterol had fallen, and you know, I don't need to take any medications. So, and that was a lot less expensive. You mentioned, you know, heart patients. My father, God bless him, is 91 years old, lives at Fuller Village in Milton, and I said, I would say he's robbing the cradle, but he has a 75-year-old special friend, which I think is terrific. He goes in the pool every morning, and he went all of 2010 without going to the hospital once, after having a series of heart attacks previous to that. So he's now in his 92nd year of good health, and I think his walking and swimming and positive, you know, personal habits has contributed to that. So, all right, we're going to get the hook here. So here's the most important question. Given that this runs now just in my district, I'll give you a little hint. In all your years in the Massachusetts Senate, who would you say is the most capable person with whom you've had the... No, I'm kidding. So, any final thoughts?
It's going to be a difficult year, but if we can all work together, we'll get through it.
Okay. Well, thank you very much. My guest today has been Senate President Therese Murray. In 89 Senate presidencies, the first woman to take the helm in a difficult and challenging time here on Beacon Hill. We thank you for joining us. We thank the Senate President Therese Murray from Plymouth for joining us, and look forward to seeing you next time. Thank you.